Now cytotoxic is type 2, immune complex is type 3. I think we should change the answer. We should make it B. Correction of question number 81, third answer which is wrongly given. Okay. Dryer is for H agglutination, Felix is basically for O agglutination, as all of you know. Now, what are the stains and counter stains? You know, Genesian violet is for the primary staining. We apply dilute iodine which will fix it, hence it is a moderant. Decolorization we do with alcohol, and counter staining we basically do using the carbol fuchsin is what need to be remembered. Now, the various phases of the bacterial growth. Log phase, the cells stain uniformly. In the log or exponential phase is what we have to appreciate. Should be an answer. What is the most common inherited bleeding disorder which you are going to answer tomorrow's exam? I expect it. Only Amit is honoring me with wrong answer of hemophilia, which is most commonly given wrong answer. Von Willebrand disease is the most common inherited bleeding diathesis is what need to be remembered. Now coming to the various media, Commeal, Czapek dogs, Sabouraud, they are all fungal. What is Thyoglycolate, doctor? It will permit the growth of the anaerobic bacteria like the Clostridium, which will be selectively growing typically in the lower part of the medium is what you have to ultimately remember. Now coming to the Anthrax bacillus, it is the one which is bamboo stick in appearance. Corynebacterium is the only gram-positive organism with a pili. Salmonella requires tryptophan. Okay, should be an answer. The most common inherited cause of hypercoagulability, who is going to give me the correct answer? Yes, Dr. Manu says APLA, antiphospholipid antibody. Dr. Samira also says, only Amit is right. Factor 5 Leiden is what need to be remembered. That's good, you make me proud of this. Now, club-shaped spores, we find it in the case of the perfringens. HBsAg is Australian antigen. Vanco-resistant enterococci. But you want to use a drug that doesn't interact with P450 system. What is the best drug? Linezolid is the one which need to be basically remembered in this context. Then coming to pneumocystis, we use double strength cotrimoxazole as a very important prophylactic drug. Should be an answer. There is anemia, absent radii, thumbs, absent thumbs, cephalous spots, microcephaly, pancytopenia. Which anemia I am talking about? Yes, one confident answer. That's right. Tar is a good guess by Dr. Anuja. Fanconi is Anantapur, Dr. Pallavi. Everybody answer it as Fanconi. That's right, Fanconi is the correct answer. Today my energy levels are low. This is not the way I teach, but somehow we will finish 2:40 and walk out. Bear with my low energy levels. 104-degree temperature muscle rigidity. It is called haloperidol associated malignant hyperthermia. Clozapine is mainly required for what? It is mainly required for negative symptoms. Which negative symptoms? Withdrawal is an example of a negative symptom. Whereas if you look at the traditional antipsychotics like haloperidol, they are good for positive symptoms. What constitute positive symptoms? Hallucination, delusion, talkativeness, strange behavior. They are all basically called as positive symptoms. Physostigmine, butanicol, what do they basically do? They both are cholinomimetic, hence they will produce the meiosis. 10-year-old boy with fever, weight loss, night sweats, anteromediastinal mass, what is the suspected diagnosis? One confident answer. These are the classical clinical vignettes which are going to come in the exam. Thymoma is a good guess, wrong answer. Lymphoma is a good answer, but which type of lymphoma? Which type of lymphoma? Gauri Shankar also says lymphoma, but which type of lymphoma? What is the difference between NHL and HL? In this kind of a context, which one do you want to guess? Non-Hodgkin's lymphoma is the one which you are going to basically think about. There is a ptosis, low hand strength, suspecting of myasthenia. You have given edrophonium and that has worsened the weakness. What is the reason? How will edrophonium will help you? See, what is the problem in myasthenia gravis, doctor? Acetylcholine is released, but it can't bind with receptors because the number of receptors are low. How do you treat it? We give cholinesterase inhibitor. What will it do? It will prevent the breakdown of the acetylcholine, so that even those few receptors available will be occupied by higher amount of acetylcholine which got accumulated. You agree? Okay. Now, a patient of myasthenia who is under treatment is having weakness. It can occur in two situations. Number one, suppose if the amount of physostigmine which you have given is inadequate, it is unable to inhibit sufficient amount of cholinesterase, sufficient amount of acetylcholine is not accumulating, hence weakness did not improve. Second possibility, if you have given excess amount of cholinesterase inhibitor, too much acetylcholine got accumulated and it will lead to depolarization block, just like succinylcholine. You want to differentiate which is the underlying reason. How can you do that? You give one bolus of short acting anticholinesterase like edrophonium. If the weakness further worsens, that means patient is under cholinergic crisis due to excess doses of cholinesterase inhibitors. If the weakness improves, that means the cholinesterase inhibitor which you are giving is inadequate in its dosage. That is how we use the edrophonium like a test dose, is what need to be basically remembered. Why do we give acetylcysteine? It is a source of sulfhydryl groups which inactivate the toxic metabolite produced by the acetaminophen, hence they will save the liver from the injury by that toxic metabolite. Lactulose is an example of a drug which uses the ion trapping to trap the ammonia and prevent hepatic encephalopathy in the patients who are having the cirrhosis of the liver. Now shoot me an answer. 80-year-old man, fatigue, lymphadenopathy, splenomegaly, isolated lymphocytosis, what is your diagnosis? Yes? Excellent. Even our online students agree. Dr. Dilip shoots the answer as CLL, which is correct. Now metoclopramide cisapride, How do they basically act? Metoclopramide blocks the dopamine released by the presynaptic receptors, and that will decrease the release of the acetylcholine, and that is how metoclopramide will be acting. So cisapride, it will activate the 5-HT4 receptors, and it will increase the release of the acetylcholine from the motor neurons that innervate the smooth muscle. That's how cisapride is an example of a prokinetic drug, as all of you know very well. Both of them basically act by acting on muscarinic receptors of the acetylcholine indirectly, is what need to be remembered. Now, if there is a peptic ulcer, avoid prednisolone, butanicol and caffeine. They are all the true statements. Meperidine, verapamil, calcium carbonate, any of them can lead to development of constipation. Alendronate, why do we use it in the patients who are having osteoporosis, doctor? Because it will inhibit the resorption of the bone. Fluvoxetine, those who take SSRIs, selective serotonin receptor inhibitors, reuptake inhibitors. What is the common problem they all suffer? They will all have an orgasmic disorder, inability to achieve the orgasm, both the women and women who use SSRI. Tolerance and physical dependence is a problem with meperidine, diazepam, phenobarbital, any of them, if you chronically use them. But neuroleptics, antidepressants, lithium, tolerance and physical dependence is not a feature, is what need to be remembered. Now doc, give me one confident answer. Adults में meningitis किसके वजह से होता है और बुढ़ापे में meningitis क्यों होगा? What is the reason for meningitis? Which organism? Pneumo in elderly, Kiran says, and Vijayawada says Streptococcus pneumoniae. Listeria in old people is an answer shot by Amit. Neisseria and Staph aureus is Madhavi. But give me both the correct answers. One correct, one wrong. अरे ये क्या है? Negative marking नहीं है, इसका मतलब ये नहीं है. हाँ? Neisseria adults, Strep elderly is what you are going to ultimately remember. Now, how does thioridazine basically act? It blocks the dopaminergic receptors, is what you are going to ultimately remember.